Yes, greetings to you. Hopefully, you're doing well. I want to welcome you to HBMS TV Talking Health. And today, we are going to be talking about a very, very important aspect of our health, and that is constipation. We always do share these topics every Tuesday evening, but again, we come up with it again at HBMS TV, such that those people who miss out, you can always have a second chance to learn about your health. I send greetings to the Visionaries International. I send greetings to our sponsor, that is Mitiana Institute of Nursing and Midwifery. If you're out there and you want to join, or it's your child or your child who wants to join nursing or midwifery or lab technology, you can always advise them to come in. So basically today we are going to be discussing about constipation. And when we talk about constipation, it is a very common condition and this is the infrequent passage of stool less than 3 times a week. That is constipation. It is characterized by straining, passage of hard stool, and then incomplete evacuation of stool from the rectum. That is constipation, and it has very many causes. It has become a point of focus these days. Very many people out there are suffering in one way or the other because it has become a very, very common condition among very many people. So basically, if you help anyone who is out there, you need to have the basic knowledge. And we are supposed to be discussing with you more details about this. Always subscribe to our channel to keep learning about this condition. And when we talk about constipation, we have types. And these types, I want to first bring it to your notice that constipation most commonly occurs when waste or stool moves too slowly through the digestive tract or cannot be eliminated effectively from the rectum, which may cause the stool to become hard and dry within the rectum. So when we are talking about the types, we have the slow transit where people do not even experience the call to stool. Then we have the obstructive constipation. At times the patient does get the call to stool, but at the end of the day, because of any existing condition, you may find that they do not have proper evacuation. So those are the major types. We have the slow transit constipation, then we have the obstructive constipation. So you need to know, if you're dealing with people, you're helping people, which type are you dealing with. So the other thing, we need to look at the signs and symptoms of constipation. These people always experience what we call abdominal bloating. Then there's abdominal discomfort, abdominal distension, perianal pain, small hard stool, irregular passage of stool, slight headaches, malaise, nausea, bad mouth taste, halitosis. All these things happen. All these are signs that people keep on experiencing. Some of them are symptoms. So if you want to have more knowledge about this, you just need to stay tuned at HBMS TV, where we give you first-hand information, basic knowledge about your health. So those are the signs and symptoms of constipation. So basically, as we go on, you just need to subscribe to our channel such that you can get first-hand information. And more importantly, I want to talk about how do you come to a diagnosis? How do you conclude that really this is constipation? And if you're a medic or if you're anyone who wants to help people out there who have constipation, you need to take history. You need to learn something. For example, you need to talk about the frequency of defecation. Then the other one is you need to look at the nature and consistency of stool. You need to look at blood or mucus in stool. You need to look at diarrhea alternating with hard stool. You need to consider things like change in bowel habits. You need to look at diet. You need to look at drug usage. All these things are coming up simply because you must put them into consideration if you want to help somebody who is battling constipation, they are very, very important factors that you need to consider. But more importantly, as HBMS TV, we always want to give you first-hand information about the management, especially the non-pharmacological. And when we look at the management of constipation, you can talk about high fiber diet. You can talk about adequate fluid intake, almost 6 to 8 glasses of water, increased intake of vegetables, increased intake of fruits, increased intake of grains. But you need to note that constipation results into fecal impaction, and enemas can be used to promote mechanical removal of stool, but only works on stool in the rectum, not in the intestinal tract. So when we look at cereals, we look at bananas, we look at watermelons, we look at grapes, we look at popcorns, we look at very many things, avocados. All these are important things that you need to be using to live a healthier life. But more importantly, you'll find that most of us have a deficiency of all those in our bodies. That is why I would advise you to supplement your diet to be in position to fight constipation. For example, I want to talk about this wonderful product, C24/7, complete nutrition 24 hours, 7 days a week. It has over 22,000 phyto or plant nutrients in it. Then talk about its sister product, which is complete phyto energizer. Talk about the living alkaline decaffeinated coffee. Talk about the Angel E. So anyone who is at HBMS TV and want to know more details, how does it work? How does it help in constipation? You just need to stay tuned, or you turn to the person who could have sent you this link, who would have connected you to our TV channel, to make sure that they can elaborate more what is into these products and how they can help you very, very well. Our goal is to help you live a healthier life. But again, you need to put this into consideration that very many people have talked about supplements, have talked about things, but what is their role in preventing constipation? Simply because there are some supplements. For example, we can talk about iron, you can talk about calcium, you can talk about beta sterol, you can talk about some fiber foods even. You can even talk about very many other supplements like magnesium. Just know that in one way or the other, these supplements could affect you also. They can even make constipation worse. They can make it worse. That is why I want to tell you that the moment you start any food supplement and the condition worsens or it starts again, you need to visit a doctor. You need to ask somebody who is well educated. You need to ask somebody who has more information on how you can live a healthier life. I want to thank you very much for always following through. And if you want to have the best out of HBMS TV, you need to subscribe to our channel. But the good news that I have for you, constipation can be cured, constipation can be prevented in either way, either pharmacological or non-pharmacological. Thank you very much for following through, and may God bless you. I salute you, everyone where you are, and stay blessed. Don't forget to subscribe and click the bell because we have a lot in stock for you. May God bless you. Thank you.